Hi, my name is Vedha and I'm a junior at Rice University and a Stanford Care Scholar along with my teammates Mia and Yashi, and this is our project. So to start off, breast cancer is the second leading cause of death among women, and studies often report mortality trends in aggregate for Asians. One implication of this is mass heterogeneity of trends. On a national scale, presentation of disaggregated data is limited for Asian American and Native Hawaiian Pacific Islander groups. Our primary aim is to present disaggregated breast cancer mortality trends of the 6 major AA groups and the NHPI population over 16 years to understand the variation in breast cancer burden. We can see where disparities in disease burden lies to inform future screening and intervention protocols. So to study mortality and report rates, we needed numerator and denominator data. Our study uses a cross-sectional design and pulls out data on breast cancer deaths from the NBSS system, which contains nationwide data on U.S. population deaths reported by the 2003 Standardized Death Certificate. Within this cohort of women, we further stratified each individual by their reported race and ethnicity. And then for our denominator data, we used the American Community Health Survey to estimate the total population from 2005 to 2020, and then use the 2010 census to conduct age standardization. We aim to calculate proportional mortality ratios and age-adjusted mortality rates to see how these values changed over time. And as you can see here, these are our results. Figure 1 looks at the proportion of cancer deaths by site and race. We see the largest light pink bar for Asian Indians and Filipinos, meaning they have the highest BC mortality proportion. And figure 2 is focused on proportional mortality ratios for breast cancer from 2005 to 2020. We similarly see 3 groups, Asian, Indian, Filipinos, and then the NHPI group with greater proportion of mortality as compared to non-Hispanic whites over time. And as for figure 3, this looks at age-adjusted mortality rates, and we see overall convergence, but still there's significant variation in trends. For example, the Japanese have a decreasing trend, whereas all other Asian American groups have an increasing trend. And figure 4 is a heat map that stratifies the data by state, and we see that Utah has the highest proportion of breast cancer deaths compared to all other states. And as you can see here, our main findings are that breast cancer is the leading cause of cancer-related deaths for Asian Indians and Filipinos, and proportions of deaths due to breast cancer are overall increasing for all Asian American groups and Native Hawaiian Pacific Islander as well, compared to non-Hispanic whites, and are slightly decreasing for Filipinos. This granularity shows that breast cancer mortality rates are heterogeneous for the racial groups and are converging over time. Therefore, there is a need for geographically focused policy or interventions and a deeper look at specific communities to provide more detail on how to reduce breast cancer mortality for these racial and ethnic groups. In the future, we plan on studying mortality data in relation to incidence rates in order to contextualize our results, and also looking at screening and policy interventions as well. And we also hope to explore this type of data in other countries such as Canada, where disaggregation of national trends is also limited. Thank you.